pledge allegiance to the flag of the United States of America, to the republic which stands one nation under God, indivisible, with liberty and justice for all. Greet your neighbors. I never get to take the presidency. I never said no.
I did that with the one day. Oh, no problem.
Scott Allen will offer today's reflection.
I'd like to begin with a moment of silence, if we could do that, for the late Mike Schmitz, husband of Rotarian Peggy and father to Joy and Steve. If you could bow with me for a moment of silence. Thank you. And now this is like to offer an invocation. Heavenly Father, thank you for the privilege that we have to share this meal and have conversation, to live and to work with and in this club and in this community. May you bless our experiences, including a conversation with each other today. In your name we pray. Amen.
Thank you, Scott. Welcome, Rotarians, welcome guests. With our tight schedule today, we're going to skip our member highlight, but stay tuned for next week. Have something up on deck for next week. With that, I will turn it over to Secretary Lynn, Secretary's report.
Thank you, President Tom. We have one guest, John Hutchison.
Yeah, I'd like to introduce Justin. He works in the bar. He's here with us today.
Apologize.
Major 55, she is in charge. So, this is Major Vicky Clark, and she is, and her husband are the co-leaders of the Salvation Army.
Welcome. And you will see we have a few other guests that they will be introduced with the program. Just a couple of reminders. Saturday, June 14th, there's a special Rotary event at the Carousel, the opening night of Ohio Light Opera. And then also the following Monday, June 16th, we're going to do a Rotary road trip, and we're going to Triway High School. And I think President Tom will probably remind you one or two other times. We would like to go next. I'm going to introduce the Executive Director of Ohio Light Opera, our own Laura Neal. And I hope we can have an addition. We've done the Pledge of Allegiance. Can we add the national anthem? Let me introduce Jenna Grissom, a cast member of Ohio Light Opera, who will also lead us in the national anthem. So if we could all please stand. Oh, say, can you sing like the dawning night? What so proudly at the twilight last gleaming, who brought stripes and bright stars? So Laura Neal will introduce our program, our pre-program.
I'm going to make sure my diaphragm is working while I talk after that. I'm Laura Neal. I am the Executive Director and Company Manager of Ohio at Opera and a proud Rotarian. Thank you for letting us join in on today's program. I have with me two fine people, part of Ohio at Opera. Jacob Allen, you have seen before. He is our Associate Artistic Director. And beginning in late summer 2026, will become the Artistic Director of Ohio at Opera. And you just heard from Jenna, and I'm just going to pass it off to them and say thank you for inviting us.
Thank you, Lauren. Thank you for the opportunity to be here. One of the favorite things that I get to do every year is come and speak both at many organizations around Worcester, but Rotary is always very special to me, especially because my dad has been a Rotarian for, I don't know, 40 plus years, and is always excited when I call him and say, I was at Rotary this morning. We're going to take just about 10 minutes or maybe even a little less and give a little bit of an overview of the season. We have roughly 70 people, I would say, in residence right now, probably 30, 40 technicians and 36 singers, comprising our 46th festival season company. We're always very excited to learn what being in northeastern Ohio is all about. And we, having been here 20 summers now, the fellowship that you extend to the many people coming from out of town is really fantastic, and we're very appreciative of it. This year, our summer season opens with a timeless classic from Rodgers and Hammerstein, Carousel. This is a musical that is not, it's a little heavier than kind of your standard fare, but Richard Rodgers and Oscar Hammerstein II were famous for saying, at least to their close circle, that it was their favorite musical that they ever wrote. This is also my mother's favorite musical because it takes place in Maine, which is where I'm from and where she still lives, and is a story about a love interest that has taken a turn for the worse, so to speak. And I love it because it is a real story that looks at relationships in a fashion that is not as romanticized as we often see, and gets into sort of the meat of what that can really be about. I've asked Jenna to sing one short song from that show. It's called You'll Never Walk Alone. If you think of Sound of Music, which I spoke to you about last summer, this is sort of the climb every mountain moment of the show. And I understand that we've extended a promotional offer for you to see it. So I wanted to make sure to provide at least one musical moment from Rodgers and Hammerstein's Carousel. Oh. Our second show of the season is Lerner and Lowe's Brigadoon. This is what we were actually rehearsing right before we came here. Literally ended at noon and drove down the street very quickly. Um, this is a piece that speaks to romance carousel being something that looks at relationships in a real nitty gritty and not always perfect light, and Brigadoon that romanticizes them into into their most polished variety. This is poofs out of an evening, and when it reappears the next day, it's 100 years later. And a young gentleman and his friend that stumble upon this town and fall in love with Fiona, one of the members of the town, and ultimately is able to bring the town back through the mist, through hundreds of years of time because of his love for her. This is the second time I've been able to do this show here at the Ohio Light Opera. We last did it in 2015, and so we're excited to bring that back. New for this season, show 3, is Gershwin's Tiptoes. This is a show that was written in the 20s, 1925 specifically, and musicals from the 20s are often referred to as fluff musicals because the plots are not very sophisticated. In fact, the 4 most popular musicals of the 1920s, one is called Sally, one is called Irene, one is called Mary, and the 4th one is called Sally, Irene, and Mary. And they all have exactly the same story, which is some sort of rags to riches plotline in slapstick. So Tiptoes is a vaudevillian and travels around with her uncle and her brother, and is full of slapstick comedy and lots of beautiful Gershwin music. That catalog of tunes is just amazing. After that, our Gilbert and Sullivan for this season is Patience, which is coming back after a bit of an absence. It's going to be directed by Julie Wright Costa, longtime company member who retired from the associate artistic director role several years ago. This is a story that makes fun of the social movement of aestheticism, and the main character was fashioned after Oscar Wilde, and tells the story of a young shepherdess, many members of a military regiment, and solving that is the plot of the show. Show number 5 this season is Noel Coward's Bittersweet. We're kind of following this theme of something that is funny and something that tugs at the heartstrings. And if the title alone did not tell you that, Bittersweet, the story definitely will. This is a piece that we've not presented in a very long time, and is really at the center of Noel Coward's work. Our fun, if you will, it's by a German operatic composer named Edward Kunicke, and it's called The Cousin from Batavia. And this is a story about a young woman whose cousin, whom she was really enamored with, disappeared years ago. And all of a sudden, a stranger shows up in the community. And she is so missing this cousin that she hasn't seen in years that she just assumes that this person that has shown up is her cousin. And then that individual has to come up with a whole story about where he's been for the last 7 years that he supposedly was not there. And that's where The Cousin from Batavia comes up, because he makes up this fictional place called Batavia and spins all these weird, wacky stories about what has happened over the last 7 years that he's been in Batavia. This all comes to a crashing head when the actual cousin shows up. It's very much like the return of Martin Guerre, if you know that story. And hilarity ensues. We did this piece in 2000, was when Ohio Light Opera premiered it. And it was so popular that we brought it back in 2002, only 2 years later. Ohio Light Opera has never done that with any other piece other than our Gilbert and Sullivan selections. So we're really excited to share that once more and know that it will be a hit with the community. We would love to see you at one or more of our productions this summer. And Laura Neal is always available to help with tickets. And I know there's some fantastic promotional package that we put together for a few of the titles. So thanks for having us. It's always good to be here. And I hope to see you in the lobby of the Friedlander Theater at some time this summer. Thank you.
Thank you. That was awesome. And thank you, Laura, for giving us a preview of the Ohio Light Opera season. It's something that we all can look forward to. At this time, I will turn the mic over to Bobby Douglas.
Good afternoon. It's been a while since I've been on here. It's kind of fun. It's my pleasure to introduce our program today, but I'd like to start with a little bit of history and background to what brings us to you today. Back in 2015, if you all remember, we were at the height of the opiate epidemic. And at that point in time, we had one Wayne County dying from an overdose every 8 days. I had never seen anything like this in my 30 years at that time, 40 years, somewhere in there, years in the field. And I know I was really overwhelmed and somewhat daunted about how we were going to solve that. But in true Wayne Countyan fashion, the community came together with representatives from every sector and formed what we called the Opiate Task Force. And our goal was to eliminate opiate overdoses in Wayne County. We were looking for leadership, and then prosecutor Dan Lutz introduced me to Todd Carmony, who's our speaker today, who was very interested in this issue. If any of you know Todd, you know he's a voracious reader, and really had been tracking this. And my thought at the time is, who better to move this front forward than a general in the Army National Guard? Under Todd's leadership and with the work of the task force, we created a plan. Opiate deaths were reduced over 50% from 42 to, we're trying to 24 or 17, we think was the lowest number. Right before the pandemic, they were reduced significantly. And then COVID happened and overdose deaths skyrocketed again. It was really frustrating and somewhat disappointing. So in recent years, we've come together again and to reinvigorate, and we now call it a partnership for a drug-free in Holmes County, because it's not just about opiates. And we have this past spring worked together the education, so we're out speaking to different groups. So it's my pleasure to introduce Todd Carmony to you, who many of you know. Todd's a lifelong resident of Wayne County. He served 39 years in the Army and Army National Guard. He's a graduate of Ohio State University and the Army War College. In his civilian career, he was the president of Wayne Insurance Group, retiring in 2020, but remains chairman of the Wayne Insurance Board. Additionally, he serves on the Wooster Community Hospital Board, and he and his wife, Pat, a retired tri-way teacher, have 2 sons and 4 grandchildren. I also want to mention that I have some guests here. 2 of them are, you refer to them as our subject matter experts, here to help with questions. Nick Cascarelli, who you all know is a member of our club and who's joining our board next year, has served as the Wayne County Health Commissioner since 2015. Nick has been in public health for over 25 years and received his BA, master's, and doctorate in educational leadership, all from Youngstown State University. He resides in Worcester with his wife of 31 years, Christina, and their 3 children. Stage unit at Worcester Hospital. She's worked at Worcester Hospital for 28 years and has been leading her team to provide drug and alcohol withdrawal treatment for the past 10 years. We put a flyer on your table. The RAMP program, as we call it, serves 20 to 30 patients each month and works closely with Dr. Labor and 180 to provide evidence-based care and discharge planning. She earned her bachelor's degree in nursing from Malone University and her master's from Ohio University, and lives in Creston with her husband, Chris, and they have an adult son, Tyler. I will also introduce one of my colleagues, Jill Reed, who's here with us today, who's one of our manager of peer support services. And is an invaluable member of our team as well. So with that, I'll introduce Kyle. Thank you.
Oops. I know which buttons to use, so, okay. He showed me, but I didn't really believe it. So, why am I here today? Bobby told you a little bit of that story. What she didn't tell you was that Lutz said, well, why don't you come to this meeting? And, Dan was a Navy, JAG captain. And I thought, well, okay. And so after the first meeting, that's my first meeting, he calls me up and says, we need a chairman for this, task force. And he got me at a weak moment. I had spent my entire life up to that point, pretty much doing family, the insurance company, and the military. And I retired from the military in 2011. And I always felt that I didn't maybe give as much back to the community because I was gone all the time. And so I thought, well, I don't know much about this topic, but so, I said yes. Okay, I didn't, I got sucked into this. Okay? But, she mentioned, well, a military person, well, we identify an objective, we identify the resources, we gather information, and then we generate a campaign plan, and then we go do it. And there's one person in charge. I may be working with some other people, but one person's in charge. So I thought, well, let me find who is in charge of substance abuse here in the county. Well, I thought, well, gee, it must be the county commissioners. I told this to some people and everybody started laughing at me. And that's part of the problem. There is no chain of command, okay? I mean, you could go to the governor and say, he's that. The commissioners, they're primarily engaged in improving financial things and management, not necessarily in direct leadership. Then I thought, well, Mr. Nick here, okay, now he's a potential, okay, don't let him off the hook. But again, it's very diffused, okay, and most community action and this sort of thing ends up being somewhat diffused. So it took me a while to adjust my expectations from a military, okay, if this is screwed up, there's somebody in charge and let's go square it away. It doesn't work that way. And so, but it can be done effectively through cooperation and partnership. So we've done a lot of that. But one of the tougher things to do with substance abuse here in Wayne County is harm reduction. So that's what I want to talk to you about today, because Bobby and I, we talk, and I said, look, they want to get more aggressive about this in the county, really in the state and the country. But I said, we need to roll this out to people. And this is a great group because you're business people, you're professionals, okay, lots of folks. So if you kind of understand what harm reduction is, then I think we're off to a good start. And we want to do this as some other things too, just so people have some idea as to what this looks like. Because when this got started back a few years ago, it was, well, they're handing out better crack pipes. Okay, the government's paying for better crack pipes. Well, that of course went nowhere. Okay, but there's a lot more to harm reduction than that. And Wayne County, we do have a drug problem, as Bobby said. When we got started on this in the mid 2000s, we were losing 35 to 40 people a year to overdoses. Okay, and we were able to drive that down in the course of a few years. So let me see if I can hit the right button here. Not the right button. Not the right button. Uh-oh. Right button.
I told you the wrong thing.
I thought, anyway. Okay. I normally use a clicker, so that's much safer. Okay, so what is harm reduction? The big thing is we're trying to reduce the harm associated with taking illegal substances. All right, so, I think people are pretty much aware that there's any number of things that can happen there. The thing to realize is addiction, it's a brain disease, okay? And You may get involved with a drug one time, nothing happened, maybe a couple times. You may be able to go along like that for a long time. Look back at Oxycontin and some of the early stuff, okay? People were taking that for pain and this sort of thing. Over time, they became addicted to it. But you can also take this and immediately your brain goes, I want nothing more than this the rest of my life, okay? That you don't know what direction you're gonna go, okay? So the idea is that if someone's addicted, how do we reduce the harm also associated with that? All right. What is harm reduction? So we're trying to prevent overdoses, infection, prevention. I was in the hospital, talking to one of the nurses there, and she told me about someone who had come in and had sores from injection sites all the way down in the muscle in their arm, okay? Now remember, this is a disease that says it's more important for you to continue to shoot up than to go get that taken care of, okay? Or to take care of your kids, this sort of thing, all right? We're trying to get people to get engaged in treatment, all right? But how do you do that? You have to engage them somehow. So by sometimes using harm reduction strategies, you get engagement and then you can now move them forward. Safer use, managed use, getting maybe to stop completely. But really, it's trying to meet people where they're at. Everybody's got a story. Everybody has a story. Okay. I think this is one of the better slides. So prevention is one way, harm reduction is the other. Primarily, we want people not to do drugs, period. You know, we work prevention, we work it in schools, hospital. I mean, a major part of 180's mission is to try and do prevention, okay? If not prevention, delay the onset. It means rather than let kids get started early, delay them. Particularly when you think about alcohol, tobacco, it's the same thing. Can you delay that a little bit longer? Then, if they do get involved with it, can you quickly help them get treatment, get them stopped before it just becomes a way of life, okay? Because once you get into the tertiary part of this, where now this is all you do, okay? Then you have a completely different set of friends, activities, and things that you're doing. Very hard to come back from that. You can come back, but it's very hard. People get 20% of the people that have been clean, in other words, gotten off drugs for 5 years, relapse. So it's a very, very tough game once you get there. So those people, how do you help them stay alive? Okay, till you can get them engaged and in treatment. That's what we're trying to do. As we mentioned, the overdose deaths really spiked up during COVID. I need to keep flipping my slides here too. 25 was going very well. In 24, we only had 10. In 23, we had 20. In 2020, we had 37. Okay, and as we mentioned, we've had gusts up into the 40s in the mid 2010s. So that's pretty good. Your EMTs are out all the time running to help people with overdoses. Okay, in Ohio, we've been over 5,000 Ohioans dying. You know, now we're down to last year a 30% reduction. So Ohio had one of the biggest drops in drug overdose deaths in the country. Part of this epidemic that we've been in here in the Midwest is actually moving to the West. Okay, so these drugs come in and out, sweep in, and then maybe hit different groups. The opioid thing really kind of missed the Black population, but now it's kind of eating into them. Okay, Oxy was really kind of a white person drug for some reason. Okay, just like crack was identified with certain minority populations. Well, now it's moving on. So the good news is we're down from 110, 107,000 people to 80, but 80,000 people, think about that. Vietnam War, 10 years, 58,000 deaths. How many people have been to the wall? Vietnam War, okay. How many names are on that wall? 58,000. We do that in 9 months with drug overdoses. Think about that, okay? World War II was 400,000 dead, okay? We did that a little less than 5 years with overdoses. So you would think of the effort and what we did in World War II. Mobilize the entire country, put 16 million men and women under arms, okay? Went all over the world to stomp out fascism and our enemies, okay? Completely changed America. Civil War and World War II really changed America. So I sit and look at this epidemic and say, we're killing as many people, but are we really approaching it in a manner that requires the effort that it should? So this is a pretty good graph. You can see when we got started back in 2015. Wasn't too bad. It went up quite a bit. Now that's the oxy. Those are the illegal pills. Okay, and then we kind of plateaued into heroin. Okay, and then here towards the end, we started moving into what I call the fentanyl area, synthetic opioids. Okay, and then that plus COVID bumped everything up into over 100,000. Now we're kind of tailing back off that again. I've tried to read up on why we think that's happened. We can blame harm reduction strategies is one of the reasons it's down. Okay, another one is maybe we've killed so many people, there aren't that many left to kill. Now that's a sad commentary, but that's potentially one of the reasons. The good news is it's bending down. It's fairly recent. So what do we do as far as harm reduction strategies? Noxolone, which you'll also hear it called Narcan, okay, is one of the big inventions we got. It reverses the effects of the opioid. Okay, so the drug gets on your receptors in your brain, starts slowing your respiration down. Okay, to the point where if you overdose, you basically stop breathing. What Narcan does, and it can be injected in the nose or even with a needle, it knocks those opioids off those receptors and keeps them from coming back for a while, so you get a chance to breathe. Teaching people about that, also trying to reduce the stigma. Okay, all this drug activity, it's not, I mean, for the most part, particularly in Wayne County, it's not done out in the public. You know, we don't have a tenderloin region like San Francisco or someplace like that where outdoor drug use is just part of the landscape. But if people are doing it alone or hidden, you can't get them help. And as Nick pointed out, last year, pretty much all the overdose deaths we had, those people died alone because there was nobody there to administer the Narcan, okay, to them if they had an order to call 911. So hepatitis C, HIV, if you're sharing needles and this sort of thing, you're going to spread disease. One of the things we've done here is have a quick response team. So if you overdose here, EMTs, you know, you go to the hospital, whatever, we have a quick response team that goes out to try and contact that person, offer them support activities, try and get them to agree to get into treatment. Medically assisted treatment is actually giving people a pharmaceutical grade replacement for the opioid. Okay, but it's not going to have the it's going to be, let's say it this way, it's not going to have the repercussion of stuff that's mixed up in a number 10 can. In other words, you don't know when you take an illegal drug how strong it is. Okay, but a pharmaceutical grade drug, you do know. Okay, so much safer to use, and it can stabilize a person till they can get treatment, they can get a job, they can take care of their family. I point out that 70 to 80% of the Wayne County Children's Services cases have a drug component to them, you know, through the parents. So if we can solve this problem, we can solve a number of other problems. Fentanyl strips, clean syringes. I think everybody's heard of clean needle program. Fentanyl strips allow you to test the drug to see how strong it is. And then another example is drunk driving laws. That's harm reduction. So it would cost us about $1.5 billion to get more serious about the program. But we would save about $7 billion in healthcare costs. And Stacy and I could both tell you that there's a direct impact on the hospital with people that have substance abuse problems. Same people show up over and over. That's one of the reasons we started the RAM program, okay, which helps people detox from it, although a lot of our folks are alcoholics that are trying to detox. And the interesting thing is, you'll feel like you want to die with an opiate withdrawal, but alcohol withdrawal can actually kill you. Okay, so Stacy and her team, medically assist and try and get people through those first few days. And then we try and hook them up with 180 or other organizations that can help them move forward. The look down there at the bottom, that's the Substance Abuse, Mental Health Services Administration. Alcohol is still the biggest abuser. Bobby's always pointing that out to me. Tobacco, drug abuse, a little bit less. What are we getting ready to do here in Ohio? That's going to be interesting. What have we done recently as respects drugs? Yes. Okay. If anybody thinks that's going to help things, particularly with young people, it's not. Okay, I think I've already covered these things, less emergency department. Our EMTs get burnt out on this. Okay, remember, they get a call, they jump in their ambulance and respond, and they're getting there as quick as they can. So they're putting their life at risk to get somebody, Narcan, and to evacuate the hospital or make sure they're okay. Well, if you can't over time move that person to some kind of treatment, they're going to be back out there again. There's cases where they're out there twice in the same day. Okay, it's an addiction. The noise in your brain does not stop unless you calm it with the drug. Okay, and so you can be saved at 8 o'clock, but by 2 in the afternoon, you're back shooting up again. Okay, so it's a very tough game. Stigma: only 1 out of 10 people are receiving treatment. Okay, now think about the opportunity there to get more people into treatment. And I would say that Wayne County has pretty good resources for that. I mean, we've built out, right? We have treatment houses, we have sober living houses, we have facilities to help with this. We even built a new facility where mothers can have their kids with them while they're going through therapeutic and behavioral health work to get themselves free of the drug. And so we've got those things, but sometimes it's not enough. If you don't have a bed, a lot of times people say, okay, I get it, I want to get into treatment, but there isn't a bed available right then. And a day later, they've changed their mind. Okay, you've got to have resources available where you can, when somebody makes that decision to go stop, that you can take them someplace. And we're just not quite built out that far yet. So got some quotes here. What difference does Noxalone make? Okay, so this is a 180 line. Narcan prevented my children from becoming motherless. Okay, I mean, to me, that's the whole thing. Okay, I talked to one police chief here in the county years ago, and he said, I was pretty tough on this. Why don't we just let people die? They're stupid enough to get involved in this. Why don't we let them die? Well, then a family that he knew, a neighbor, and he knew the kids, he knew the family, and one of their kids died. Okay, and he realized it has nothing to do with family. I mean, you could, sure, there's all sorts of different situations, but the fact is anybody can get involved in this. Admiral Winfield, he was the commander of all of North America, okay, and NORAD, the intercontinental ballistic missile system that protects North America and this sort of thing. He was a 4-star admiral, okay. His son got involved in oxys, okay, and of course they get him in the best treatment that they can. They have long-term treatment for him. He was 15 months in treatment, came out all healthy, ready to go. He was going to become an EMT. He was signed up for school to be an EMT. His dad talks to him. He's out in Colorado Springs where he's gonna go to school, okay? And remember, this kid's, he's been clean now for over a year and a half, you know, and getting good, you know, in other words, he's really with the program. Well, he talks to his dad and said, yep, I gotta go get my books and stuff tomorrow morning. And 20 minutes later, he walked by a drug park where people were doing drugs, and for some reason walked in there and died that night. Okay, and so Admiral Winfield, he actually spoke at the, that's where I heard the story, was at the Ohio conference down in Columbus. Okay, so the best families, the people with great resources and stuff, can't always save everybody. Okay, so they talked about that. There's another quote. This is from Chief Sally. I think everybody can read these, right? I mean, I think it's big enough they can read them. Okay. I think this is a good one. Being able to save a person's life, then be able to proceed to take the next step in eliminating opioids from their life. And Nick and his group, it's called Operation Dawn, but they provide training in how to use Narcan. And we were one of the early counties to get that out. So that was an early example of, and probably our best, I would say our best example of harm reduction was to get Narcan out so that people wouldn't die from overdoses. And we've now moved into some of these other things that I talked about. But what we need is the community to understand what harm reduction is, you know, so we don't get pushback saying, well, why are you doing that? Well, we're trying to keep people alive. Okay, you can't save somebody once they're dead. You know, and I consider myself a pretty tough soldier, but I could not argue with that, you know, that thought process. So what are we trying to do? We're trying to save lives by doing that and engaging people by, you know, if you have to exchange needles, got to go someplace to do that. If you got the right person there. Okay, and a lot of times what we use is people that have recovered, okay, because they know everything that that person thinks about because they've been there, but they also know that they can recover from that, okay? And then at the same time, we also hope to save healthcare and all the other costs associated with that. Okay, at this point, I'd like to go into questions, cover a lot of ground here. I've got, like I say, I got experts here, so if I've confused you, ask a question.
Hi, thank you for being here. I was curious the collaboration or overlap between harm reduction and task force with drug enforcement agencies in town as well, like sheriff, that way.
Yeah.
Like on Holmes.
What?
Holmes.
Yeah. Is he here?
No.
Oh, okay. No, I understand what you're saying. The guys and gals that deal with this on the law enforcement side, okay, they want a different approach too. All right, so there's tension there, okay? But Josh Hunt, I mean, he's real big into drug endangered children now and this sort of thing. We're trying to, so Oregon got rid of all the law enforcement for drug stuff. They tried this, and I followed this for a number of years. They've now gone back and actually now they're arresting people again. Why are they arresting people? Because they arrest them to get them into treatment. Before, they would take the drugs away from them and say, okay, you have to call a center where you can get help. Well, nobody called the center. Nobody did anything, okay? And as Judge Spittler once pointed out, you gotta have carrots and you gotta have sticks, okay? And people that get involved in the law enforcement side, all right, and we're building a new jail, okay? And Sheriff Ballinger was the president of 180 for a while, so he understands this issue. I mean, I'm very happy about who the new sheriff is, because I think he's going to be able to help us work this law enforcement substance abuse, you know, program that we have. But you got to get people's attention. Okay. In the military, we use sergeants. They say, there's a lieutenant, you say, Sergeant, takes Private so-and-so and have a little talk with him about how he needs to act, and this sort of thing, okay, well, and that works, from that standpoint. Did I confuse you, or did I answer the question? Okay, this is our first time doing this, so I'm a little curious as to how this is being received or what questions they're gonna have. That's why I brought reinforcements. Other questions?
Amazon. Todd, fentanyl's in the news a lot. Are most fentanyl deaths to people who know they're using fentanyl, or are some material percentage of fentanyl deaths from people who accidentally take it because it's mixed in with something else?
Yes. There are. So about 80%, 70–80% of your overdose deaths are fentanyl related, okay? And we now have a number of different, they go into that organic formula and they may change certain parts of it, okay? So it's not quite pure fentanyl, but it's a synthetic opioid, okay? So, and now they mix it with other stuff. So we have people, Nick gets these reports, and people that have died, they have all sorts of drugs in their systems. They have meth in their system, they have cocaine in their system, they've got marijuana in their system, they've got fentanyl in their system, okay? And part of the problem is that your criminal gangs, they put fentanyl in to other products because it ramps up your desire to have that product, okay? And what happens is, I was 5 o'clock this morning, I'm listening to this mother talk about what happened to her wonderful daughter. I mean, she was bright kid, but she suffered from anxiety and stuff. She orders a pill on Snapchat, thinking it's a Xanax, okay? And the local drug pusher drops it off at the house. She takes it. She died in the bedroom on Christmas Eve, okay? She didn't come down for breakfast. The other daughter came down, went up, found her dead. And that what she thought was Xanax, or they think they're getting an oxy or something like that, was laced with fentanyl. And it only takes, you've got salt shakers sitting on your tables. 3 or 4 grains of salt is the amount of fentanyl that will kill you. Okay, so when you see they're stopping hundreds of pounds of fentanyl, okay, when they say that could kill the entire population of the country, in effect, it could. If you divvied it all up and gave us all, kind of like Jonestown, everybody took their dose of it, you could kill the population. Now, the interesting thing is, we have the drugs are still coming into the country. They've been slowed down, okay, but they're still coming across. The thing I find there, this stuff isn't warehoused, okay? It's going right from Mexico in here, and it's getting consumed. It's not sitting in warehouses like, a government surplus corn or something like that. So the demand is tremendous still, okay? So that gets me back to prevention. We really got to work prevention piece, convince people, do not go down this road. But we're all old enough here, know people that have gone down the alcohol road. It's kind of the same road. So yeah, it can go both ways. What else?
Question on how do people find you to help get help with it? How do people find that? Is it relationships, referring to people, or how do they get started with needing help?
Why don't you answer that one, Bobby? We'll get a professional up here.
There are a lot of tools on the internet, to be honest. A lot of people just will Google whatever. We're actually spending some money on SEO optimization right now so that people know that 180 is available for people. But a lot of people come through what I would call through referral sources. They come through their clergy, they come through their doctor, through a friend, wherever. So that's why it's so important that everybody know what the options are in our community. We are blessed. We have a full continuum of care available here. We have capacity here. Services are provided regardless of people's ability to pay. So there's no reason people cannot get care. So,
And in addition to the people here today, the mental health board is a major player and resourcer of these things. I say, if you're a substance abuser, you gotta get a different set of friends, okay? The people that got you into this, okay, aren't the people that are gonna get you out of it, all right? And so, we need engagement for people that have these issues. We need understanding. That's part of this deal, okay, is through harm reduction and understanding that, hey, this person has, as Bobby pointed out to me, if you have diabetes, we don't say, sucks to be you, okay? And then not everybody manages their diabetes, okay? So they show up at the hospital, they haven't been managing their diabetes. We don't say, we're not treating you because you could have prevented this sort of thing. No, we take care of them, okay? We're a compassionate country. Well, when it's all said and done, what is the difference between those two things, okay? Because a lot of times diabetes can be caused by lifestyle, so is drug abuse. So when you pull those things together, as we roll out some of this stuff, just consider, the bigger picture as to what we're trying to do. Because if we can keep people alive, we have some chance to move them into treatment and help them get better. And we have there's a lot of people who've been through this, okay, and are functioning members of our society right now, which is what we really want, and taking care of their families too. It's really tough with the kid thing, and that's standpoint. I think we're good here. Yeah.
Did you have Narcan, you just don't believe that you have someone in your circle that might need it at one point?
I would say yes, okay, if you're around any place, we're trying to get it in all the schools. I think we've been pretty successful in getting into schools. Police carry it, our EMTs, we're trying to put it in different stations. Stacy doesn't really know this yet, but we're talking about putting in a vending machine in the new, neither of Scott boys don't think of, but a vending machine potentially in our new emergency department that we're building up there. In other words, 24-hour access where you also have, where it's not gonna freeze and this sort of thing. So trying to have it out, you can either, you can go online through Ohio Recovery and you can actually get it mailed to you, okay? It doesn't cost that much to get it out of the pharmacy too. So, I mean, we really, everybody, we destigmatize having Narcan, okay? So, yeah, if you think there's any chance you're gonna be around folks that might need it, you could save a life. I mean, it's the same reason I carry a fire extinguisher in my car, right? Okay, thank you very much. Thanks for being here.
Well, thank you, Todd. And appreciation for the program and your visiting us today. This rendition of the Rotary Wheel, the 4-way test on back, made by students at the Village Network. Oh, cool. So, all right, thank you. Okay, next meeting will be next Monday on the 9th. And we'll be visited by Ryan Hayden of ATI, hosted by Kim Sayers. And also, thank you, Laura, for the Ohio Light preview. She also informed me that there are going to be 2 nights at the Ohio Light Opera, which were designated as 2-ticket Rotary nights. Carousel, June the 14th, Brigadoon, July 5th. And as I understand it, 2 free tickets for every Rotarian.
No.
Use the ticket price. I tried to slip that one past, but obviously the keeper of the pocketbook caught me. So, yeah, reduced ticket prices for those 2 nights. So any other questions? Obviously see Laura and don't see me. So with that, we stand adjourned. Thank you.